Yes, indeed. We do have Dr. Tommy Coker, Commissioner for Health, Ogun State, here in the studios. Thank you for coming on this morning.
Good morning.
Well, as it were, I mean, there are 2 new cases now for Ogun State. And we do know, yes, the state did announce some measures to ensure that you're able to contain this. But how is it playing out at the moment in Ogun State?
At the moment in Ogun State, as you mentioned, we have 2 new cases. In total, we have 9, although we've tested for over 120 patients, individuals, and out of that 120, we've had 9 positive cases. From those 9 positive cases, we've had about 210 contacts, which we've contact traced, and we've been able to discharge 120. But in the last 7 days, we've had a 150% rise in the number of admission. So we had 4 scenarios played out for us, the best scenario and our worst scenario. Up until 7 days ago, we were doing better than our best scenario, because even with the best scenario, on day 46, which is where we are from the index case, we're expected to have about 40-something patients, positive cases, have about a lot more people being admitted, but we've only had 9 people admitted so far.
Why do you think that's the case?
I think that would be because earlier on, when we had the index case, the contacts were contained.
Okay.
They were contained in a restricted environment that they were strictly monitored. So the risk of community spread was completely nullified. And within those 40 contacts, we only got 1 positive case because each individual was confined into an isolation place for the 14 days period, and they were diligently monitored twice a day. I think that was one of the key factors, containment, because when you look at it, in other countries that have been able to actually control this, places like South Korea, is the isolation prevention. Nigeria, we would be challenged to try and treat, the curative aspect. But if we can focus on the preventative, which is the strategy we've taken so far.
But what is the overarching thing that you might have noticed in this 150 that you say you were admitted?
No, 9 people we've admitted.
Okay, I thought I heard you tested 150.
Yes, we've tested 120 something.
What's the target? What are you looking to achieve?
Okay, no, the target is, there is a case definition by the NCDC, which says the people to be tested are people who have symptoms and have a history of travel or contact with someone who's traveled, or strong symptoms suggestive of COVID-19 disease. So those have been our case definition for criteria for testing people in Ogun State. And that has led to testing of 120 people. And the last 2 cases, interestingly enough, came from the United Kingdom. The last 24 hours are people who returned from UK on the 17th and 19th of March. So they've gone past their 2 weeks.
So what, are they going to be off?
No. They've just been diagnosed yesterday.
Oh.
And that's interesting because we've always said that 14 days, after 14 days, they're free. What had transpired is they came into the country and they had one of their contacts tested positive in Lagos. And so we were notified in Ogun State, and we followed them up and tested them, and they've proven to be positive. Oh. So there is the risk there because, number one, at the time they came into Nigeria, UK was not one of the countries we were monitoring. So there is that interesting mix there.
But why wasn't UK one of the countries you were mentioning? Because they've had their case for a while now.
No, at that time it was 5 countries. It was Italy, it was China, it was Iraq, there were 2 other countries but UK wasn't one. It was later that UK was included and America was included.
Okay, you said you had contact traced 200 plus people?
Yes.
Any testing necessary as at now?
With contact tracing, if the individuals are not symptomatic, you just follow them up for 14 days to see if they have developed any symptoms. Out of the 200 that we contact traced, 2 contacts actually developed symptoms during the 14-day period, and they tested positive.
Now, in following them, one of the challenges in our community, in our climb here, is that of isolating people that we expect to be isolated. How do you manage that, given the economy that a number of all these people might be exposed to, the kind of homes they live, the kind of facilities they're used to, and the communal lifestyle that we have here? How is that managed?
So, as I mentioned, in Ogun State, we've focused mainly on the preventative aspect, and we've focused on isolation. What we've done is, each time we have a case, we actually stratify the people. The first, the index case, we had a facility where we could house all the 40 contacts. The following case that we had, case number 3, I'll call it, was in the private hospital. And what we did was we stratified the people and asked their sort of accommodation which they had. And for the individuals that we felt they had the arrangement back home where they could self-isolate, we let them go. But the individuals that we felt they had multiple occupancy, which would cause the call face me, I face you in the colloquial term, we actually retained them within that premises and isolated them so that we could ensure that the self-isolation was complied to. So I think that's one of the successes in Ogun State, in that we have not just left our contacts to go home and isolate. We've assessed their ability to isolate themselves.
Okay. Well, still talking about testing for Ogun State. I know that nationally, people are looking to see if other people who do not have severe symptoms can come forward for testing. I mean, Ogun, about 11, 12 days now for this lockdown.
Yes.
What kind of people would you like to come forward for testing, since you don't have as much cases as some other states?
So, as I said, Ogun has taken the strategy for prevention, so we've upped our surveillance. One thing we've done, the first thing we've done is we've deployed a mobile app which allows people to sit in the comfort of their home and self-assess to the risk of having COVID-19 disease, which would categorize you to mild, moderate, and high risk. And within the Ministry of Health sits a dashboard that flags up the people who are high risk. It flags them red. And then the state epidemiologist then picks up the phone and contact them and screen them. And if they're at risk, we actually go out and test them using the swab, nasal swab and nasopharyngeal swab. So those sort of people, we're very keen to follow them up. What I would advise people to do is actually use this application, which they can get to by going to www.covid19.ogunhip.com or USD code of *723 *19 *2 hash. With that, they can get onto this tool, which will give them an assessment of what their risks are.
So have you had anybody who's done this before?
We've
then
had
come through for
several
testing?
on a daily basis. We actually look at the dashboard and pick up the reds and follow them up and go on to test them. So
anyone in isolation from that?
Not anyone. No one has been on isolation on that.
Do you mind repeating that short code again?
Yes, sir. *723 *19 *2 hash.
And that's, with that, the person gets...
onto this app that would give them an idea of their...
So it's a web app. It's not like they can go to an app store to download it.
You can actually go to Google Play and download it as well.
Okay. Now, one of the... well, we are winding down in this segment, but one of the things, a catchment of people that, people continue to praise and thank and worry about are the healthcare practitioners. They are the endangered species. They are the armed forces now. What is the plan in Ogun State to protect them and to make sure that they are not endangered?
Well, I'm very grateful to the healthcare workers in Ogun State. They've shown such commitment. And with these frontline workers, what the government has been able to do through the support of His Excellency Prince Dapo Abiodun is to provide health insurance for our frontline workers. Also, we have been able to provide them with hazard allowance, and we continue to look out for their well-being. We've provided them with PPEs of various levels, starting from goggles, gloves, masks, and the entire PPE kit, depending on their level of exposure. We have also pre-positioned PPEs in all our 20 local governments, in our primary healthcare centers, to make sure that, because as you know, most people are nearer the primary health centers than general hospital. So we have pre-positioned, we have trained all our staff in infection prevention and control, and also we make sure that they have access to regular training with another mobile app which we've deployed to our staff, so that we could reach them with up-to-date information from NCDC or WHO as it comes out, because I've got over 7,000 frontline workers, and it's easier to reach them using technology. And talking about technology, we also have been able to actually procure 2 molecular labs within the state to help us increase our testing to the capacity of about 1,000 a day. So all this is going on, and we are employing people to actually engage with the testing. If you have any symptoms of fever, headache, you feel generally unwell, extreme tiredness, if you have any suspicion that you might have been in contact with anyone who may have COVID, we would encourage people to step forward and get tested. I
did read an article where you were quoted to have said parents are giving their children sanitizer to drink. Did that actually happen?
Apparently so. I was informed of that. That was what led me to actually making that statement, because initially people didn't understand the disease, and they were panicking and using all sorts of remedies that were not scientifically based. So we had to caution parents not to give their children sanitizers.
Wow.
There's a lot of risk communication that has also gone on, because you have to think about the different cadres of a society. So we've used the National Orientation Agency, BALES, or BAS, local informants, so that we can really get our information to the grassroots, the understanding of the disease and the risk that it poses to them, and how to prevent themselves from getting it. And the government has been able to provide access to water in public areas, because this is one of the most simple ways of preventing this disease. So not sanitizers, washing your hands with soap and water. The sanitizers are only there for when there's no access to running water and soap.
What is this thing we hear about people stigmatizing hospitals where people who have got COVID-19 cases have been to?
Unfortunately, we had an incident where an individual had presented to a private hospital, and the proprietor acted promptly and referred the patient to us, got screened, and we admitted the patient into one of our 4 isolation centers, which are across Abeokuta, Ikenne, and OUTH. Subsequent to that, in Shagam, which is where one of our isolation centers are, subsequent to that, the people attempted to actually set the place on fire, attack the individual. But what we did was we went into that community, got in touch with the Oba of that community, did an awareness program to educate them that the proprietor had acted responsibly, and we haven't had a repeat of those incidents. We're engaging more of our private doctors to be involved in the response. As you know, 60% of the people of Nigeria actually access care from the private. It's paid from the pocket. So we know that to win this war against COVID in Ogun State, we have to engage with our private doctors as well. And we are providing them with PPEs and sanitizers, all the support that we could muster up, we've done.
Just one more thing. I know this may not be directly within your purview. It's security related. All of these reports we hear about the outskirts of Ogun State, whether it's cultists or robbery incidents, but lots of young people just congregating together and doing things. So are you concerned about that? Because this could make or mar all the efforts to at least break the spread.
Prince Dapo Abiodun, Excellency, the Governor of Ogun State, recognized the risk this was posed, the risk of the lockdown, locking people down for 14 days. And if you look at the Ogun State strategy, it actually involves having every 48 hours a break, of allowing people to go out, fend for themselves, replenish on their food, and then retrieve back into their homes. But whilst outside, we have encouraged them to continue to cover their nose with mask.
Right.
That is to stop, to reduce the risk of this young people, having to resort to other means to fend for themselves.
All right, Dr. Tomi Koka, Commissioner for Health, Ogun State, thank you for your time and all the best.
Thank you very much.